Wednesday, September 24th. I'm Adam Walsh, and this is The Signal. Wildfires, extreme heat, drought conditions, climate change is impacting us all, and it is impacting our health. Today on the show, we talk about how people and communities can adapt to what is coming and how we are being impacted. All right, we're going to have a bit of a chat, and we'll open the phone lines in a bit as well for your thoughts. And today, it's what are your thoughts about climate change and impacts on your health? So we're going to, like I said, talk about how we're all impacted or how we can be impacted by the different kind of bits of climate change that can hit us. So this summer we've just been through, I know in my home, wildfire smoke came through the window and had to close the windows, and it's in the middle of summer and it's hot, so there's stuff there to think about, obviously. In the news today, you've got Torbay and a water situation. There's also news of dry wells. There's also talk from farmers talking about not being able to grow enough hay in this province compared to where they normally are. So there's lots to unpack. I've got a great lineup of folks here to do it. Let's start with Dr. Itai Malkin. Tell us about yourself.
Hi, good morning
right.
or afternoon. It's great to be here. Thank you for inviting us. My name is Itai. I am a medical officer of health here in Newfoundland and Labrador, provincial public health system at the NLHS. And that means I'm a public health physician, so I did medical training in Ottawa and McMaster. And I did primary care as well as public health specialty, and that includes doing a master's in public health, and I did some courses on environmental health. And I live in St. John's now, and I'm very excited for this.
Dr. Stephanie Atkinson is here. Hi, how you doing?
Hi, it's great to be here. I'm Stephanie Atkinson. Thanks for having me.
Thanks. Tell us a bit about your background and who you are.
Yeah, so I'm also a clinician. Maybe less predictable that I'm here. I'm an orthopedic surgeon by trade, but I came here to this space more from the perspective of as an environmentalist. So I worked for CAPE as the chair for 2 years.
So Canadian Association of Physicians for the Environment.
That's correct.
Right.
Yeah, sorry about that.
That's okay.
So I joined CAPE very early on here in Newfoundland and Labrador, but had followed their work nationally for some time, and I guess that's how I wound up in this conversation.
All right. Well, thanks for coming in. Next to you, we've got Pablo Navarro, a research. I'm not going to read your background. You tell us about it, sir.
I'm a researcher at the university at the Newfoundland and Labrador Center for Applied Health Research.
Yep.
We do health policy work, and we help the province's health system figure out how to make better decisions.
All right. And on the line, we have Dr. Samantha Pomeroy. How are you doing?
Hi, I'm doing well, thank you. It's great to be here.
Good. Tell us about yourself.
I'm Sam Pomeroy. I'm a family doctor. I live and work in Corner Brook. This is why I'm not there in person today. I'm currently on maternity leave, so middle of the day phone calls are fine. And I have a background. Prior to medical school, I actually did an earth sciences degree, and I'm a biology minor, so I had an interest in the environment pre-involvement with all of this. But now I've taken over from Stephanie as the CAPE NL chairperson, so heavily involved with advocacy in the province now from the physician perspective.
And from a note, you're also a proud graduate from Holy Spirit High School, right?
Correct. 2011, class of 2011.
All right. So, yeah, from the class of 98. That's great. A fantastic high school that I always like to talk about.
Wonderful.
Dr. Pomeroy, stay on the line for a second. We're going to, there's a little bit of we're going to see if we can just get a better connection. So the crowd, Kira in back there, is going to call you back and just to see if we can kind of fine tune a couple of things. But we'll get back to you shortly. For today, the big start off I'd like to, you gave your introductions, but when we talk about climate and the intersections of health, what jumps to your mind? Whether it's impacts or like the beginning for you of really thinking about why you cared about it and why you wanted to get into it and why you thought it was so important. Go for it.
I think for me early on, I started to see such waste within the system. And that maybe encouraged me to sort of look for that intersection between health and medicine, or health and environmentalism. But from there, it just started to snowball because I started to realize that every decision that we make, every test that we order, every X-ray, every blood test, it all has a cost. Um, and and that for me was how I sort of started to venture further into things and think, we can do better than this. It's a little bit like when they started putting the calorie cost on menus in restaurants. It felt very like that to me
Right.
because I started to look at the menu of tests that I could order, and is there value here? And does that value align with the cost?
So then with that, I mean, on the professional side, where were you on the personal side of, because you came into medicine already thinking around the climate. So what were you also doing personally around this time as you started to have this professional realization?
Right. So I think personally in my life, I started to understand again that the decisions that I was making had such an impact. So I started eating a plant-based diet. I started, like everybody, I'm peeling the plastic windows out of my envelopes at home, and
Oh, yeah.
it's all irrelevant as a single act, but so relevant as a culture or as a sort of a heuristic, I guess, for moving forward with your life. You sort of make decisions that are better for the planet, which ultimately means they're better for you. Like we're all one. The One Health concept became very real for me.
Okay. Itai, what about yourself?
Well said. I think maybe from a health perspective, when you're talking about climate change and health and why it matters, how it impacts us, the first thing that comes to mind is that everybody is going to be impacted. And, me being in public health, I will keep in mind the social determinants of health and those who are more vulnerable because of stigma or access or whatever it might be to impacts of climate change. And we always talk about equity and even inequity when those who contribute to the problem might not suffer as much as those who don't contribute to the problem. So from a public health perspective, I always look at how can we work with our most vulnerable folks and dear partners to do some targeted interventions to support them through this now and into the future.
Yeah. If you are lower income, if you're living somewhere in a community that also doesn't have, that's not a city, that perhaps doesn't get as much TLC for infrastructure as it deserves, you're going to be impacted differently than others, right? So if a flood comes through and you don't have the proper systems there to get rid of that water, maybe, your home floods. Or maybe you don't have insurance, or maybe, you don't have an air conditioner in the summer because of money, and you're getting impacted that way. So some of this is what you mean.
Yeah, if you think about some of the elements of the determinants of health, we talk about income and education, but we also talk about childhood experiences and health care access. So people living in remote communities, we know they're far away from hospitals.
Right.
They're also farther away from emergency response. Those folks would have potentially a higher tree density where they live. So we're talking about the wildfires and the smoke. And we know that smoke comes to St. John's, and as we saw this summer, which is a reminder that everybody is affected by this. But definitely those groups would be more vulnerable. And like the income, it's going to cost a lot to retrofit houses to filter the air or to raise it above floodplain levels. And we do have to think about this. And I think that's why I love my job in public health. In general, we get to work with priority populations with targeted interventions.
All right. Pablo, what about yourself?
I'm a nature lover.
Yeah.
It's a big part of the reason I live in Newfoundland and Labrador. And I really believe that we live in nature. And for me, climate change was fundamentally changing nature.
It's such a Canadian thing.
And that is going to be, I suppose it is. I think I'm very Canadian in that respect. I like being out on the land, so to speak. And I saw climate change as a fundamental threat to that. Yeah. So that really sort of raised my awareness. And in terms of, you're saying how do you change once you realize that? What do you do differently in terms of consumer choices and whatnot? And for me, I think the biggest thing has been to talk about it, is to actually have conversations about the reality, about how people feel and what their perspectives are on these kinds of things. Because until we really communicate about it, it's going to be very hard to do the collective action that we need to do to actually have the change that we want to see.
All right. I think we've got Dr. Pomeroy back on the line. Samantha, you there?
Yeah, I'm here.
Hey, excellent. This sounds great. Tell us about, for yourself, as a family physician, and also now the chair of CAPE NL Regional Committee, so the Canadian Association of Physicians for the Environment. What was your kind of entry point around thinking of climate and health for as they intersect?
I guess, so I joined CAPE NL in 2022. I can't even remember how I became aware. It was probably Stephanie made me aware of the fact that it existed. But I think for myself, just growing up here, and I love the snow. I love going outdoors in the winter. I like to ski, snowshoeing, all of that kind of stuff. And in the last 10 years, it's been a drastic difference in the qualities of our winters. And it's very easy to relate that back to climate change. And so looking at that from like just how it impacts me personally, it's really easy to extrapolate that and say, well, if this is happening just to my recreational activities, what about people who, rely on the environment to make their living or for their way of living, like further up north and that kind of thing. And so I think that was a really big eye opener for me, but also just in my undergrad, just learning about the planet and like really we are changing. Like we're in a new era now, like the Anthropocene, because of the impacts that we're having with all of our fossil fuel use. So I think that knowing that and seeing it happening in my life, like right in front of my eyes, Marble Mountain has been much less able to keep open through the winter because of warmer winters and that kind of thing. And that really spurred me to do something because it feels really helpless to sit back and watch things happen and do nothing about it. And when it comes to health, I think as a family doctor, so much of my job is about prevention and trying to keep people healthy for as long as possible so that they can live the best possible quality of life. And when we're seeing climate change impacting people's ability to stay well, because, when there's wildfire smoke, it can exacerbate asthma, and like about 11.5% of Newfoundlanders have asthma. Like that's a huge, huge, huge number of people who are potentially going to have to go to the emergency room. Like wanting to keep my patients from getting more sick because of climate change is a big driver for me as well. And then also I have 2 small kids. I want the planet to be like, explorable for them as they get older, as it has been for me. And I'm really afraid that as the climate changes and environments get destroyed, that's not going to be a possibility for them.
All right, so Samantha, they're talking about wildfire smoke, asthma for doctors. What else is out there for when we talk about the impacts, whether it's from this summer or just other impacts from climate change on people in Newfoundland and Labrador? What else is on your minds?
So I think for me, it's still related to the wildfires. I practice in Carbonear, which is very adjacent to the Kingston fire that we just had. So we had significant kind of backlog and significant cancellations of people's appointments and surgeries. And that was as a result of the state of emergency there with the wildfire. So I think my patients who already are having prolonged wait times to access the system for MSK care or any kind of care, but for me specifically MSK care, are now being further negatively impacted and having to wait longer because of those cancellations. So I think that that's very significant actually for people's longevity and health.
We've done loads of shows on the health system, on social determinants of health, on the health accord, and looking at some of the issues. And folks can have comments and thoughts around some of the functioning and how we're trying to improve systems at the best of times. And then when you throw in a wildfire or you throw in some kind of unexpected delay and you think about what that can mean and then what those delays and impacts can have on folks as they wait for their stuff. To use a big medical term there, as they wait for their stuff. As you can see, I'm trying to dumb down my lingo here because that's actually as high as I can go. All right, so there's that. What else is there that you're thinking about?
Yeah, I think you touched on a few important points, and they're making me think of the Chief Public Health Officer of Canada's report. So they released one in 2022 that highlights climate change as a public health issue, and they actually list categories of health impacts. Yep. And I'll just list a few, but the document is available online for all interested and are nerdy like me. And so extreme heat events. So that's what we like the acute kind of like it's really hot. And there is a definition for each province. So in Newfoundland, higher than 28 degrees for more than 2 days without nighttime relief, or a really hot day of over 30. I think those are the right numbers for Newfoundland. And infectious diseases is another world that we're going to see interacting with climate change, whether that's through vectors like mosquitoes going further north because it's warmer.
Ticks.
Ticks. Yeah, we love some ticks. I actually participated in a tick dragging research in Ottawa to identify how many of them have Lyme disease. This was like 10 years ago now.
That sounds like a hoot.
It was a hoot. I wore like a Ghostbuster kind of white thing, and you're just dragging. So that's how we start to collect information about that. And you know, permafrost melting, there is reasons to believe that now infections that would have been dormant there can come back. So of course, this is all active research. Yeah. But and there's water, there is food, there is mental health consequences from events. So anyway, there's a whole bunch. It really is a whole of society, a holistic approach to health. If we're going to consider climate change and health, it's really, really hard to pick and choose. And just the other thing I wanted to highlight was there's like these sudden acute impacts. So smoke, asthma exacerbation, evacuation. But then there's the chronic stuff that we have to think about. So what does chronic exposure to smoke mean?
Yeah.
Lifelong or years. What does living in a warmer world mean? What does living with mosquitoes that can now carry all these diseases that they didn't before, like what does that mean for our day-to-day? Like, do we have to change our habits? So lots is going on.
Yeah, there's just so many impacts, right? So much to think about. And we're also, with this show today, we're going to be talking about adaptation and solutions. So when you and I were talking in the lead up to the show, you mentioned some research on HEPA filters and N95 masks, right? One of the folks connected to that on the West Coast, not the West Coast of the island, the West Coast of the country, Ryan Huff, Environmental Health and Knowledge Translation Scientist, National Collaborating Center for Environmental Health in British Columbia. Ryan is on the line right now. Hello.
Okay, thanks, Adam.
Thanks for coming on the show.
Yeah, thanks for having me. So to get right into it, us or my colleagues at the NCCH and NCCMT has been working on a series of systematic reviews with Health Canada, really to look at two common recommendations to reduce your personal exposure to wildfire smoke, and that's the use of portable air cleaners or air filtration devices and masks. And really, the idea behind these reviews was to answer two key questions. Are they effective, and are there health impacts?
Those are literally the two questions I was going to ask you, so I'm glad you mentioned them. So could you go for it. Answer away, sir.
Sure. Okay, so to give you a bit of background first so you can understand a bit of the results that we found, wildfire smoke is a complex mixture of both gases and particles. And so we call the particles fine particulate matter, or PM2.5, and that's just particles under 2.5 microns in size. And we talk about those particles a lot is because those are the particles that can penetrate deeply into your lungs, and those are the particles that we want to scrub out of the air, either through mechanical filtration or other technologies. And so when we look at these air filtration devices, most of the research we found were on portable devices that used things like HEPA filters to scrub these particles from the air. And to give you kind of the most useful information about what we found in terms of wildfire smoke, during heavy wildfire smoke periods, so these would be when wildfire smoke plumes are drifting into the city and they're above a certain PM2.5 level that we know as 27 micrograms per meter cubed. And the reason why that number is important is because that's the specific Canadian air quality guideline in which we know that we're going to have significant health effects after. And so we know that these devices can reduce indoor, so inside, this fine particulate matter, or PM2.5, by 66%. And so you get pretty good reduction when you use these devices inside.
My experience with this started when I was living in South Korea in the early, 04, 05, 06, because they get what they used to call yellow dust coming over, and I would see people wearing masks. And now when I go to visit my in-laws in South Korea, they've got HEPA filters inside with air purification stuff. And then if things do get really bad, typically in the spring, you'll see folks with masks on, N95s. And I've been wondering that ever since, especially then as we went through the pandemic and stuff. So then for folks in Canada, and especially like when we think Newfoundland and Labrador, where this can be newer with wildfire smoke, I'm thinking you talked about some of the what it does. What's a message for people to start to think about for if we get another summer like this that is filled with wildfires? And I mean, given the way things are going, it won't be surprising.
Well, really, there's a lot of good recommendations on how to prepare for wildfire smoke. Health Canada has some great documents. We also have some stuff at the BC CDC and the NCCH that people can freely look at. But really, it's just important to prepare in advance for wildfire season because wildfires are not going away. And we know from the data that we are going to have wildfire smoke impacts across the country continuing forward. And so some of the really important things that you can do are consider getting a portable air cleaner with a HEPA filter. And if it has a activated charcoal filter as well, that's even better. And also, if you can't keep your whole home clean or cool, just focus on one room at a time, such as your bedroom or the room that you spend the most time in. And then also, if you have a health condition, make sure that you have a supply of rescue medications on hand. So if you have asthma, make sure that you have your inhalers refilled prior to wildfire season. And then also, if you don't have access to cleaner air at home, there are community centers in most towns and places in Canada that do have air filtration built into their systems. So things like libraries, shopping centers, community centers, consider going there for a rest if you find the smoke really starting to irritate your symptoms.
And then for wearing N95s out and about, I know like when we sent reporters to cover wildfires, we equipped them with N95s because they were going up and within a safe distance, obviously, but they were around us. So talk to me briefly about that.
Yeah, so that was actually one of the other main topics of the reviews we looked at, really to see amongst the literature how well do respirators, and I'm talking specifically about well-fitted N95 respirators, how well do they work when you're in wildfire smoke, or how many of the particles do they filter? And we found that they filter over 94% of wildfire smoke particles, and that was tested in the laboratory conditions. And so we know it works. It does filter the particles and reduces your exposure. But the most important thing to think about when wearing a mask to try and reduce your exposure is that fit is the most important thing. It doesn't really matter that much if you have a poor fitted mask because the air pollution will just go right around it and you'll breathe it in just the same. So that's the key factor because we know that poor fit can drop it down to 40 to 60% effective.
Okay. Ryan Huff, anything else before I let you go?
I just would say thank you for allowing me to talk a bit about my research, and I hope it's useful and can keep some people safe during these ongoing and problematic wildfire seasons.
Very helpful, very useful, and I appreciate your time on this, and thanks for coming on the show.
Thanks, Adam.
Ryan Huff there, Environmental Health and Knowledge Translation Scientist, National Collaborating Center for Environmental Health in British Columbia. We had him on the line from Vancouver. So, folks, thoughts here in the room on what Ryan was saying? Like, this is the world we're living in, right? Like, okay, how do we, like, I have a HEPA filter in my home, in the living room. I think it's partly because my wife's from South Korea and everything I just mentioned for growing up for her and now with me. But what about yourselves? What you think? And like living, working in Carbonear, right? So close to where everything. What about for yourself?
Yeah, I think I would very much echo those advice. For us at home, we have also installed a HEPA, but I also want to recognize quickly that that's not necessarily accessible for everybody.
Yeah, it's financial. There's a financial barrier to it.
There's a significant financial barrier to it. N95s, again, there is a significant barrier to that, especially a well-fitted one. So we all in healthcare are fitted for N95s on a semi-regular basis, but that's not true of the majority of people. So I think that recognizing that, I guess, as a vulnerability, like how can we, what can we do on a community level to improve things for people who simply can't purify their air or have access to those kinds of respirators? And I'm not sure that I have an answer to that, but I do think that looking back at the season of wildfires, and recognizing what our vulnerabilities were on a go-forward basis could be really helpful.
Yeah.
And I'm sure that in the public health sector, they're very likely to be working on some stuff around that now.
Yeah, Itaya, go into it if you could.
I think what Ryan highlighted is kind of top of mind for me as well. I was always worried about the gases in air pollution, that even if we think we're safe because we have a mask or a filter, that we are protecting ourselves from smoke. And we are, but in particular matter is the largest contributor to health impacts from smoke. But there are gases. One common one from forest fires is volatile organic compounds. And it was really music to my ears when I attended his talk 3 weeks ago to learn that if it's activated carbon coating on the filter actually interacts with the gas particles and removes them. So that's an extra layer of protection. And to your point, it's not necessarily accessible. And I think in general, public health has a lot of what we call wicked problems. And it's going to be a multi-barrier approach. It's going to be a multifaceted approach all the way from individual to systemic level. So perhaps this opportunity to empower individuals, what they can do, and masking and HEPA filters, but also preventing exposure in the first place. So just educate yourself about the AQHI or air pollution. And if you don't have that number, we just say if you can smell or see smoke, don't go outside. And those who have the underlying conditions like asthma or heart disease, not only add the medications like Ryan said, but a lower level of air pollution should also keep you from it. So preventing exposure is the best thing to do. And when we can't do that, we filter and we use masks. And that's kind of empowering individuals. But of course, there's so many levels to this.
Yeah, and this is why these conversations are so important. It's like, okay, so what do we have for this? Well, we have masks and there's HEPA filters. Well, those things cost money and not everyone can afford them. Okay, so then what do we do? And this is, you have the public conversation, and then you have the policy folks, you have the voting folks, you have the folks in the health communities advocating and trying to figure out a way to work forward. Paul, before I go to you, I want to go back to Dr. Pomeroy on the line. Samantha, any thoughts from you?
Yeah, I think I just want to highlight the particular difficulty for people who are living in, say, like aggregate living facilities, like long-term care or personal care homes, because they really don't have any major control over any of those things, like having filters and that kind of thing in their room. So I think that from a healthcare system standpoint, we really need to be making sure that we're protecting vulnerable people in these populations. So making sure that there are monitors in place to keep track of the concentration of particles in the air. And if it hits a certain level, so I think the level is greater than 30 micrograms per meter cubed, that's when we need to start worrying about protecting our staff and patients from like a kind of a secondary prevention standpoint. So we know what's in the air. People need masks now. Ideally, we'd keep that out of the air by having filters in place. But having this in the back of our minds, like the last 3 seasons of wildfires, 2023 was our worst, 2024 was our 3rd worst, and 2025 has been our 2nd worst on record. So this is not going away. This is a really alarming trend, and we need to be preparing our government buildings and any kind of private buildings that have vulnerable people living in them for this sort of thing going forward. Again, it's not necessarily accessible for everybody in their homes, but also being aware, don't go outside if it's really, really smoky, and everything else that's been reiterated already. But yeah, I just wanted to highlight that concern with vulnerable seniors in particular.
Yeah, fire weather season in Canada is expanding, right? Starting earlier, ending later. And we're experiencing it here. Friends of mine who moved here mentioned during the summer when the wildfires were happening, they said when they first moved to Newfoundland, they thought, oh, thank, they used a couple other words, but they said thank you and then a couple other things. And then they said because we didn't think there would be wildfires here. And here we are, right, with the things that are changing. And again, to remind folks from climate change world weather attribution, when it comes to a heat wave, every heat wave in the world is now made stronger and more likely to happen because of human-caused climate change. So the points for reporters on reporting this and journalists, don't be too cautious. Heat waves are unilaterally linked to global warming. And that's from World Weather Attribution. You can look it up. Pablo, thoughts?
Yeah, I think there's kind of a bitter irony that we get through this pandemic when clean air was really a huge issue, only to then get hit with wildfire smoke and a different version of the clean air issue. And I just want to bring back a lesson from the pandemic years
Sure.
that I think can address some of the issues we've been talking about now in terms of equity. Not everybody can afford a HEPA filter. They can get very expensive. But you can make a DIY air filter yourself for about 40 to 50 bucks.
Yeah.
With a box fan and a couple of air exchange filters from Canadian Tire or any other store that you care to shop at. And these lessons are important lessons to hold on to. And I think especially in a province like Newfoundland and Labrador, which really prides itself on our DIY ethic, that there are ways to do this that can be accessible to everybody. And you can even have community workshops where you build these kinds of filters to distribute to people who might not have the wherewithal or the skills to make it for themselves. For instance, older couples who are still in their home, or for that matter, filters for long-term care facilities that might need them, or schools, which is another whole area where air quality is a major issue. So I definitely think that it's daunting, but I think that if we put our heads together, we can definitely tackle most of these issues at the local level that we have to deal with.
Yeah, and these are the conversations we're going to be having, right? And a little while, we were at, was it St. Catharines? We went to a K-12 school, and they talked about, because 50 students at this school, a Salmoneer line. They talked about having schools, especially in rural settings, more like as community hubs and having seniors come in. Now, as we're talking about climate change and wildfires and DIY air filters and having seniors come in and learning, there's ways to think further on exploring how to do things here, which I think are, as you're saying, well suited to Newfoundland and Labrador. We're going to take a couple calls because I looked at my call sheet finally. We've had a couple people waiting patiently. If you have thoughts about the impacts of climate change on health, you can give us a shout. 709-722-7111, 1-800-563-8255. Email us, thesignal@cbc.ca. Peter's on the line from St. John's. Hello.
Oh, hi, Adam. Can you hear me?
Yes, I can. Thanks for waiting. How you doing?
I'm doing well, sir. Thanks very much. My name is Pete Noel. I don't have a background in health at all. I worked in the offshore petroleum industry for 25 years. No, actually 35 years. I'm sorry. Most of my work was related to, just one second, there you go. Can you hear me?
Yeah, no, you're still there.
Hello?
Yeah, no, you're still there. How you doing?
Okay, that's better. I had an echo. I had to adjust my phone.
Yeah, no, I've been there.
Most of my work in the offshore petroleum industry for those 35 years related to the prevention of major industrial disasters. And first of all, before I get into that, I do want to thank all your guests for their interest and their activism. I think it's wonderful and it's very inspirational. It inspired me to make a phone call when I'm frightened to death to talk in public. But anyway, so most people think that the current climate disaster is a novel thing, and of course, in some respects, it is. But basically, from my perspective, and this goes beyond an analogy, the current climate disaster is, in effect, a major industrial accident, has the same root causes, has the same contributing factors, followed the same pattern so far, and most likely is going to have the same trajectory. Now, I've read this story a dozen times before and it don't end well. So my major point is that the climate disaster is here. It's not 5 years in the future. It's not 10 years. It's not 40 years in the future. It has started. And what's going to happen now is it's going to escalate far more quickly than climate scientists are telling us. And I think your folks in the health sector are probably going to be some of the first people that are affected. And so it's just a warning that people better move very, very quickly on this because we do not have time. This sounds very drastic, and many people will think I'm nuts, but if I had my way, I would shut down the production of fossil fuels tomorrow, regardless of the consequences, because the consequences of what we're doing now is definitely going to be far worse. and it's definitely going to happen much, much, much more quickly than even advocates and client scientists are telling us. Anyway, that's my 2 cents worth. It's a warning, and I know people aren't going to heed it, but I thought I should throw it in there. Thank you.
Thank you, sir. I appreciate the call. Pete Knoll there, calling from St. John's. Joining me here, well, not joining me, with me in studio for the full show, we've got Dr. Itai Malkin, Medical Officer of Health, Family Doctor, Advocate for Climate Change Preparedness, Dr. Stephanie Atkinson, Orthopedic Surgeon and member of CAPE, which is Canadian Association of Physicians for the Environment, on the line, Dr. Samantha Pomeroy, Family Physician and Chair of CAPE NL Regional Committee, and Pablo Navarro, a Research Officer at the NL Center for Applied Health Research at Memorial University. So you had Pete Knoll call in there, talking about some of what we were talking about before the show, actually. Any thoughts on what he said, or with this look forward from each of your perspectives of what we need to plan for, adapt for, adjust for, think about? Dr. Atkinson.
I think to start, I'm deeply appreciative of that call because I think that we all appreciate already that this is happening more quickly than we anticipated. Dr. Pomeroy mentioned earlier that she's got 2 small kids, and so do I. And I have heard similar messaging from very important folks within the environmentalist movement, and I have found that very jarring and very anxiety-provoking. So for anybody out there, I think, who is experiencing that right now, I think that that's real, and I recognize how you're feeling. And to kind of move forward from that point, I think that we are certainly in it, and we are certainly at a point where we need to start thinking about mitigation while also thinking about the future. So I think we need to improve things going forward in terms of our consumption, particularly of fossil fuels, but also in general, while actively mitigating for the situation that we're in now. So educating yourself on the topics that we've been talking about, wildfire smoke, how to not start a wildfire is a great place to start, and not something probably that we here in Newfoundland and Labrador have spent a lot of time thinking about in the past. So there's that. And then if you're out there and you're in the healthcare sector and have already been impacted by this stuff, educate yourself a little bit around what you can do at work and at home to mitigate things in the moment, but also going forward. Like, is there major changes that you can make in the way that you practice that may have a positive impact on the climate going forward?
There is empowerment in that, right?
There is so much. There are so many glimmers of hope, and sometimes they're difficult to see when you realize that you're already in it. And I think it was Dr. Navarro who earlier told us, sorry, I lost my train of thought there for a second, but he had mentioned that there is hope in terms of mitigation while also accepting loss. And I think maybe that's where we're struggling a little bit, or I'm struggling personally anyway, to accept the loss piece of this. Yeah. But it doesn't mean that there isn't anything that you can kind of do individually or professionally or and certainly on a community level.
Yeah, no, look, and that's the range I think a lot of folks feel on it. It can feel overwhelming. You can wonder, what can we do? And you look at the stuff that you really can't help. And then it's like, so, but how do we, if we are going to transition away, if we are going to try to meet climate targets that have been agreed to globally, how do we keep moving forward with action? Pablo, what do you think?
I wasn't sure what direction that call was going to go in. I thought it was really interesting. Yes, I thought it could go in a whole bunch of different directions. But the overall message that it's all hands on deck now is an important one. And I think that as scary and as overwhelming as it is, there is great liberation in taking action. There is great relief in coming together with your fellow citizens to try to make something better, no matter what it is. Just pick something small and start there. You don't have to solve all the questions. I like to start with community. I like to start with my neighbors. I like to know who my neighbors are. We have a small community garden together, which is mostly a hobby. We're not going to feed ourselves through the year with it. But those kinds of networks, those kinds of social networks that you build are a really important social determinant of health. And I think it can provide resilience and resources to actually tackle some of these challenges.
Yeah,
so I like to start at that level.
And you're connecting with people, and also you're connecting with the actual soil, and you're growing stuff. And in a land where a lot of things come from boxes that we eat, it is a nice reminder to be that connected to the earth, because when we think about everything else and climate change, it's nice to start from the ground up.
It is.
Yeah.
Small wins are important.
Sam Pomeroy, you're on the line still. What about yourself? Any just thoughts as we look down the pipe, especially for someone who's the chair of CAPE right now for the NL Regional Committee?
Yeah, thanks. I also wanted to echo the appreciation for that call. I think it is really, really important for people to accept that this is happening and be aware of it, because there's been so much denialism, I think, in a lot of different circles, probably driven largely by corporate interests. And I think that we need to be aware of that. And one of the big CAPE campaigns nationally is actually promoting a ban on fossil fuel ads, so that we can't be exposed to these companies trying to greenwash what they're doing, which is, actively contributing to the destruction of a lot of environments and habitats on our planet. So being aware of how the messaging is given out and received by the public is important, so that we can try and mitigate the harms from that part alone. And then also just trying to keep some hope, as has been stated by Dr. Atkinson and Dr. Navarro. There are things, lots of individual actions that we can do, but also recognizing that it's not the responsibility of any one individual person. Individual actions are important, but they alone are not going to make the changes that are necessary for our country to meet the climate targets, right? So we need, broad, sweeping policy change that's going to help prevent worsening of our current climate crisis. And another thing to be aware of is, in Canada, we're experiencing increasing of our temperatures at 2 times the rate of the average global increase. And in parts of the north, it's actually 3 to 4 times as fast. So it is as pressing as Pete referenced. We are going to see those changes faster than a lot of the world. And so for that reason, I think that Canada needs to be a leader in that, and showing we care about this because we care about our population, but also we care about the planet in general, and somebody has to take the bull by the horns and go for it. And I really hope that going forward, our current federal government can make some changes with this new mandate that they've been handed. I really hope that the climate is part of what they're planning on making some big change about.
Yeah, we wait and we watch for policy, and it's the same with the province and the municipalities as well. Dr. Malkin, what about yourself?
I have too many thoughts, so you might have to.
You've been
cut me
scribbling furiously on your little piece of paper there. So what are some of them?
So first, thank you, Peter, for calling. I think we're touched by your story, especially from your perspective, and what we've been alluding to, this eco-anxiety, eco-grief, climate anxiety. It's a rational response to uncertainty and maybe feeling hopeless. In the medical community, we say that symptoms are not necessarily a disorder if they don't cause you dysfunction in the day-to-day. You can still... So I say that feeling the eco-anxiety is a normal response, and maybe we can use that as a reminder that we should work together towards something. And I loved your framing, Pablo. That reminded me of another report that Dr. Tam released the year after, which is on emergencies and community resilience. So coming up with strategies that are community driven. And to Stephanie's point, it's not, Samantha's point, it's not the individual's role, but the outcome of community resilience is from the bottom up, and they can withstand anything that's thrown their way. And I think that is a beautiful solution to this problem. Also, our isolation problem as kind of like that not a new epidemic, but the epidemic we're seeing in isolation. And that leads me to my third point, which there are so many co-benefits to doing things that are good for the planet. So we don't have to feel burdened or... to me, it's exciting. If you're trying to just reduce your carbon footprint, and you want to switch your lights to LED instead of incandescent, you're all going to save money because you use this so much less energy.
They like last forever. I've got the ones I switched,
Yeah.
it's still going.
5 years,
later.
right?
It's bonkers.
And in public health, we also encourage active means of transportation, so walking, biking. So guess what? That's reducing carbon footprint, but also good for your cardiovascular health. And if we want to plant trees, it's pretty. They clean the air from carbon dioxide. They also protect us during heat, and it's good for animals too, which I love. So there are so many things that should be done for the environment, just of those co-benefits, and I think that's a really big place that we have to explore. And then finally, maybe I'll just organize it by saying that as we move forward, there's mitigation and adaptation. Yeah. So mitigation means climate change. The climate is changing, but we can reduce how much it's changing by, or at least prevent it from changing even
lower
faster.
Carbon pollution.
Lower carbon pollution, lower rate of temperature increases. I mean, the ideal would be just flat. I don't know, there's 10,000 years of up and down, but we're talking about like human time on Earth. And then there's the adaptation. We know it's going to get hotter, wildfires. So how do we protect our health during a flood or during a wildfire? So two can happen at the same time. And just remember there are co-benefits to climate action. And I think it's an exciting opportunity to get a community to do something together.
Yeah, and I think from your community gardens to you're talking with your doctors about climate impacts, getting some advice on and just how to adapt, all these conversations, if we talk about that individual bit, but that's everyone being connected, and then maybe talking to the people knocking on the doors who want votes about, well, where are we going with policy or what are we doing here? The more that education gets around, there is power in that, and power moving for a country and where it wants to go for its own policy. We've got a few people on the line. Let's keep this brief, but I would love to get the brief thoughts from everyone quickly. Mr. Whitaker's on the line, Dick Whitaker from Portugal Cove. Hello again, sir. How you doing?
I'm all right, but you haven't got much time.
I know we're getting down there, but so sorry about that. I've been poor on the clock today for managing it, but go for it.
Yeah, first of all, hope and mitigation is self-destructive. You ought to think about that, because what it does, it gives people a false sense of security. Instead of getting on with the problem of fixing the climate issues up front. So I think, you need to be a bit careful about that. It's not the solution. The solution is, as Peter said, is we've got to get off our dependence on fossil fuel. And while we're talking, there's a cruise ship in town. CBC in themselves seems to glory in them turning up, but they're adding to the problem in a huge way. People are self-indulgent and traveling more and more and more. That's adding to the problem in great terms. So it isn't just a matter of government control. It's a matter of self-control, and that's not happening. And I think we really need to, there's tuna in Labrador this year. They're telling you something. Insects are missing. Why? There's something, they can't cope with this, and some insects are thriving, as you know, with the ticks and this, that, and the other. So if we don't get on it, we're very fast running out of time, I think. And one of the other things that is a bother to me is I never hear anyone talking about the impact of the now 50% more carbon dioxide on our lungs and our health in that sense. I don't know. There has to be some kind of effect, It affects creatures, small creatures, so it must affect us. So I'll stop there.
Thank you, sir. I appreciate your call as always. Dick Whitaker, folks. Before I go back to the panel, Craig Lewis is on the line from Bay Vert. Hello, Craig.
Good day. My quick comment would be, what's making us all sick? Is it the water, the air, or the food? We have these highest rates of cancer in Canada, I guess here in Newfoundland, obesity, all these health issues. And yet today it's a beautiful sky, not a plane in the air. And there's other days that I see a plane fly over, and we have these chemical trails that are spraying out, and the cloud dissipates across the sky, blocking the sun, and it's having an effect on us. Like the gentleman just said, there's no bugs. I drove across Newfoundland several times this summer, and I hardly had a bug hit my windshield. That's very uncommon, right? The birds are flying up out of the ditches into the vehicles because they're disorientated. So we need to take care of our environment.
Excellent point. Thanks so much, Craig. Craig Lewis there. All right, Sean Callahan's on the line. 30 seconds, Sean, because I want to get one whip around before the show is over. One really focused point.
Thank you very much for that and your guests. Very simply, as people are listening to us right now, they have control. They're in their cars. They're letting their cars idling from the time they go through a Tim's and sit alongside maybe and drink their coffee in the morning, or they're waiting for their kids outside school. And they're harming the very children that they're there to pick up, because the lungs are picking up all that air and particulate, whether it's diesel vehicles or gas vehicles. You know, this year we have almost 25.5 million vehicles in Canada out of 27 million that are idling, whether it's diesel, small diesel engines, or regular gas engines. And unless we do something about that, and we can do something, each and every one of us can do something.
Excellent, Sean. We're going to leave it there.
It takes nothing to do that.
Thank you very much.
And the last thing, one last thing.
5 seconds.
Turn off your air exchangers when you get home, because they're pulling in the smoke from your neighbor's smoke, from your chimneys, and from the garage fires. It's terrible for your children's lungs.
Thank you, sir. Be well, and I appreciate your call as always. Whip around for final thoughts. Pablo, we'll go with you first.
I think these are conversations we need to keep on having. We shouldn't think that it's just going to end with this show. And, engage your physicians and engage your elected representatives.
Dr. Pomeroy has been waiting patiently on the line as well. How you doing? Final thoughts?
Thank you so much for having us. I'm really excited to see that these conversations are occurring, and I encourage everybody, next time you go see your family doctor, if you have one, that you chat about, is there any medication that you could potentially be deprescribed, because medications are a huge part of the greenhouse gas impact of the healthcare system. So that's just my one little tidbit from family medicine that might be helpful. Lots of prescriptions that are written that kind of stay on as a legacy medication that don't necessarily need to be there for years and years. So bring it up with your family doctor. If there's something that you're on that you don't need to be on, it can be helpful for you and for the environment.
2 minutes left, so you got about a minute, Itai. Final thoughts from you?
I know you're seeing me writing down. I'll just be quick.
No, you can have a minute. You can have a full minute, 60 seconds.
I really appreciate people calling in, and I think to us it just shows people are engaging. And back to this community thing, we have power together. I think that next steps can be exciting, but we just have to make sure we know what we're doing. So people are throwing some associations that I think we need to just go back to be like, what are we dealing with? So I think there is a lot of evidence online on the Public Health Agency of Canada's website that tells us what climate change is expected to do to our health and what interventions can be taken both individual level and beyond. So I love to see people's passion about this. Just make sure you're moving forward informed. And I'll leave it at that. Thank you so much for having us.
Stephanie Atkinson. You have a full minute.
Oh, thank you. I just, again, want to say thank you for all of those calls. I thought that they were all very well thought out and well positioned. One of the key themes throughout the day seems to be that there is some level of individual control here. You are in control of your own behavior and very little else. So consider your travel, consider your car rides, consider your diet. Diet's come up a couple of times. We didn't really get into it, but the way that we eat in this part of the world is a huge driver of climate change. So do some research on that and think about what changes you might be able to make there. And otherwise, learn how to not start wildfires and stay healthy.
There's actually a caller left a message asked to bring up people having fires even when fire bans are in place. The point there is to just listen to the fire ban because it was in place for a reason.
Yeah, I mean that one's a very obvious one.
yeah, just a bit. Yeah, but everyone needs reminders. So thanks for this. I appreciate it.
Thanks so much.
All right, everyone, that is it for today's show. If you have thoughts for us, the signal at cbc.ca, 709-576-5260. You can leave a message on the signal line. Tomorrow we're talking about building projects. So the people power needed to do it. And we're talking the provincial and local economies. We're going to tap into a skilled trades conversation on the outlook and how elections play a role with planning and execution of what needs to be built in this economy. And I'm pretty sure climate change is going to be part of that discussion too. Cheers.